This is Talk Business and Politics with Roby Brock.
Welcome to the program. I'm Roby Brock. Thanks for joining us. The Delta variant has taken a toll on Arkansas in the last month. There have been quadruple-digit days for new COVID cases. Hospitals are once again filling up, and Arkansans have seemed to top out of taking the vaccine. That's not stopping the warnings from public health officials who say without adults taking a COVID-19 vaccine, younger children are susceptible to the Delta variant and headed back to school next month and could die. UAMS Chancellor Dr. Patterson and I caught up for a conversation. Tell me what you are seeing with the Delta variant in the state of Arkansas in terms of the demographics that it seems to be having the most impact on, and what is it doing to Arkansas's hospitals?
Well, this is not the same virus that was going around a year ago. And you talk about demographics, that's one of the big differences. A year ago, the average age of a patient who was admitted to UAMS with a COVID-19 infection was in their 60s. Remember, we talked about people who were 65, 70, had multiple medical problems. Those were the people who were at risk. Now the average age is getting closer and closer to 40. We're seeing younger people. We're seeing people who don't have other medical problems. We're seeing people who go straight from an initial symptom to needing mechanical ventilation. We're seeing more patients. We've got 4 patients today requiring heart-lung bypass. And as I talk to my peers across the state, CEOs and leaders of other healthcare facilities across the state, they're all seeing the same thing. The hospitals are full, their ERs are full, they're seeing more patients needing ICU care, they're seeing younger patients, and it's getting worse on a daily basis.
We are poised to be going back to school soon. That raises that negative potential for children who don't qualify for a vaccine, number one, maybe in some homes where the adults haven't had the vaccine because we have a low vaccination rate in Arkansas. What are you worried about in terms of that potential risk?
Well, it is a concern. We thought that young kids were bulletproof and that they might get COVID-19 infections, but that they might not be severe. That's no longer the case. Right now, Roby, there are almost as many Arkansans infected with COVID-19 who are 17 or younger than individuals who are 65 and older. So this disease clearly affects younger individuals. It strongly underscores the point that if you have a child 12 or older who's going to school, please have your child immunized before school starts. We're not going to see approval for any of the vaccines for kids younger than 12 until probably midwinter. So they will remain vulnerable. That means masking for young kids. That's going to be critical, maintaining social distance, which I know is really hard with little kids. But we're learning some lessons this summer, Roby. We're seeing, especially across the South, in summer camps, substantial COVID-19 outbreaks. And the same thing can happen in schools if we're not really careful.
You guys have done some modeling in the past. I think that you are on the verge of placing a new model out there. Can you give me a preview of what you think will be in this latest model that you may be shaping?
I sure can. So the Bozeman College of Public Health has been putting out models for COVID-19 infections going forward since almost the beginning of the pandemic. And the models actually have been highly predictive of what has transpired across our state. We will be publishing our next report on Tuesday, but I can tell you now that our models do project that we will probably get back into the same territory that we were in terms of total number of cases that are similar to what we saw back in February and March, which means 3,000 plus new cases identified a day. Now the problem is the model also predicts that because this will be the Delta variant rather than the Alpha variant or the original virus, that a greater portion of individuals will require hospitalization and ICU care. So we will be at a point at our peak, if this model is correct, where we will have over 1,500 hospitalized patients in the state of Arkansas at any one time. And if that happens, that will clearly outstrip our ability to care for every patient, both COVID-19 positive and patients who are coming into the hospital for other reasons. We simply don't have the hospital beds and, more importantly, the staff to manage that many additional patients.
We've seen opposition to mask mandates. We've seen vaccine hesitancy. The governor has stressed personal responsibility. There does not seem to be the stomach to impose strict guidelines like we saw under the pandemic emergency. How do you think the state should respond if this model that you're projecting comes true?
We already know that masking works, and masking has worked here in the state of Arkansas. Masking and social distancing are the things that we can do right now until more people are vaccinated. And by whatever means necessary, we need to figure out how people mask up, maintain social distancing, and really take this seriously. This is a life-threatening virus at this point.
I'm going to end us on a more positive note here. Although it's a serious subject, I'm going to change gears on you. On Friday afternoon, the Blue and You Foundation dedicated $5.2 million to behavioral health across Arkansas. This is going to benefit UAMS's resources in a pretty significant way. Tell me what the impact of that $5.2 million is going to be.
This is a huge deal, and we're so thankful for the Blue and You Foundation, Arkansas Blue Cross and Blue Shield, to take healthcare issues, in particular behavioral health issues, seriously in our state. Last year there was a 30% increase in suicide across the United States. That's due to social isolation, the stress of the virus, so many other things. That's affecting us here in Arkansas as well. The funds are going to be used by projects sponsored by Arkansas State University, Arkansas Children's Hospital, UA Little Rock, UA Fayetteville, and of course UAMS to meet the needs of people who are stressed with behavioral health issues here in Arkansas. The two projects at UAMS are an expansion of AR Connect, our online, digital, by phone behavioral health services for substance abuse issues and behavioral health issues. It's available 24 hours a day, 7 days a week for anybody in the state. And a resource initiative for teachers that will provide teachers in schools the resources that they need to manage kids who have trauma issues that are impacting them, because many times our teachers are the frontline caregivers, at the front line of these critical behavioral health issues in children when they are particularly vulnerable. So shout out to Arkansas Blue Cross Blue Shield and the Blue and You Foundation for doing something really good for us here in the state of Arkansas.
That's Dr. Cam Patterson, Chancellor of the state's largest health system, UAMS. There's more to our interview at talkbusiness.net. Back with more after this.